Welcome everyone to today's Masterclass Explainer. We're diving deep into the latest Crazy Surgeons webinar, and we've got an incredibly exciting topic lined up for you. We are exploring the cutting-edge intersection where traditional hand surgery meets modern, data-driven microtechnologies. To really frame our journey today, let's start with a pretty provocative question. What happens when a surgical intervention requires needles that are actually smaller than a single human hair? It's kind of mind-boggling, right? But that's exactly where we're headed. We're going to take a fascinating journey from the macroscopic skeletal repairs of standard bone fractures all the way down to a microscopic biological level of just 30 microns. So here is our syllabus for today's explainer. First, managing PIP joint injuries. Then, super microsurgery breakthroughs. Third, AI in surgical case analysis. And finally, navigating surgical complications. All right, Section 1, managing PIP joint injuries. Before any surgical action is even considered, we have to follow a strictly logical diagnostic sequence. Step 1, as you all know, is intimately understanding the clinical anatomy. It's an incredibly delicate balancing act of bony structures and ligaments. Step 2 is absolutely critical, obtaining proper lateral x-rays to isolate individual fingers. You can't just rely on overlapping views here. Only after we've nailed those first two steps do we actually reach Step 3, which is determining if the treatment should be conservative or surgical. It's a highly precise, non-negotiable workflow. So now we're at a fork in the road with two very contrasting treatment paths. On one hand, we've got conservative treatment. Think dorsal splints sitting in 40 degrees of flexion for stable injuries. Simple enough. But on the flip side, we have the surgical and salvage pathways. We're talking about really complex procedures here, like a volar plate arthropody or a hemi-hemate arthrodesis. These require the use of incredibly precise 1mm osteotomes, especially when you're dealing with severe cartilage defects or late-presenting patients. And for a specific mechanical solution, let's look at the C.R.A.Z.Y frame. This is a dynamic traction method for phalangeal fractures, and the big takeaway for us as practitioners is the extreme macroscopic precision required to rebuild the joint. You're using highly specific, calibrated K-wires, exactly 1.5 millimeters proximally and 1.2 millimeters distally, spaced and precise 1.5 centimeters apart. And honestly, this is the best part. In a brilliant stroke of practical medical ingenuity, surgeons can just use standard IV fluid rubber tubing to maintain that dynamic tension. It's so clever. Okay, let's shift gears into Section 2, super microsurgery breakthroughs. To really ground this clinically, we're going to look at a real-world case study timeline that perfectly demonstrates the sheer power of lymphatic venous anastomosis, or LVA. Look at our baseline. We have a 32-year-old male presenting with severe lymphedema. Following the LVA intervention, just 10 months post-op, there is a massive improvement in symptoms and a drastic reduction in tissue volume. This isn't just some theoretical marginal improvement, guys. It's a tangible, life-changing result. But what is truly wild is the sheer scale of how this surgery is actually performed. Nanomicrosurgery utilizes needles measuring just 30 to 50 microns. They use these to create tiny vascular channels for blood flow without even needing to borrow large new vessels. Just wrap your head around that for a second. 30 to 50 microns. We are quite literally pushing the absolute limits of human biology and surgical skill. Which brings us to the most crucial teaching point of today's explainer, Section 3, AI and surgical case analysis. You see, as our surgical tools get this incredibly small and our procedures become this highly advanced, manual human analysis alone just doesn't cut it anymore for evaluating these complex outcomes. Consider this number, 50. Out of a preliminary report of 79 complex lymphedema cases handled by Professor Koshima's team, exactly 50 of them were analyzed entirely using artificial intelligence. So why does AI analysis actually matter in the OR? Well, first off, it parses massive postoperative vascular datasets that our human brains simply cannot process efficiently. It identifies hidden risk factors like specific comorbidities that we might otherwise completely miss. It objectively evaluates surgical efficacy across totally different demographics. Ultimately, AI represents this massive structural shift in focus from manual observation to pure machine learning precision. Let's look at what the AI actually found in the post-op data. We're seeing a 78% good outcome rate, which is a great overall success rate. But when you let the AI dig deeper into the data, you find that only 9 out of 40 patients in the fully evaluated subset achieved a complete recovery. Furthermore, the AI was able to definitively pinpoint that comorbidities and being female presented higher risks for worse outcomes in these specific procedures. And surprisingly, it proved that age was not an independent predictor at all. This is the absolute superpower of AI, finding the hidden, vital nuances in the data that we need to improve future patient outcomes. Let's wrap things up with Section 4, Navigating Surgical Complications. It is absolutely vital for every medical professional to memorize the specific risks of septic shock during liposuction. Professor Koshima explicitly warns to avoid liposuction in inflammatory or phlebitic patients entirely. Why? Because of what are known as golden granules, present right there in the subcutaneous fatty tissue. These granules actively contain clusters of Staphylococcus aureus. So the moment a patient's immunity drops, these granules can trigger massive, life-threatening septic shock. It is a stark reminder of the microscopic biological minefields we have to navigate. We also have to be ready to adapt our clinical analyses to incredibly unique pathological histories. Take Hiroshima-type lymphedema, for example. Professor Koshima identified this during discussions about post-Fukushima disaster cases. It's a highly specific, very complex form of radiation-related lymphedema found specifically in elderly atomic bomb survivors. And because of that history, it requires entirely different, highly specialized combination treatments blending surgical and venous approaches. It's a perfect example of how specific historical and environmental factors directly dictate our modern surgical planning. We're going to end our explainer today on this incredibly powerful thought that really summarizes everything we've talked about. The evolution from 1.5 millimeter structural wires to 30 micron needles and the AI required to analyze their success represents the ultimate frontier of precision medicine. Because as our surgical tools get microscopically smaller, our AI data analysis absolutely must get exponentially smarter to ensure the very best patient outcomes. So I'll leave you with this to think about. As machine learning integrates even further into the operating room, what invisible risk factors will AI uncover in your next surgery?